A very good morning to one and all, and welcome to Homeovision. I'm Dr. Swati, and today we'll be discussing the second chapter from the Lectures on Homeopathic Philosophy by Dr. Kent, titled The Highest Ideal of a Cure. As the title itself suggests, we are going to have a discussion on the second aphorism of Organon. Before we begin the session, I'll just list out the summary of what we can expect at the end of today's session. First, Dr. Kent begins by describing the notion of a cure as per a non-homeopathic physician. He then highlights the three components of the second aphorism of Organon of medicine. He then talks about restoration of health versus removal of symptoms. He then discusses the qualities or the manner or the means of cure. And lastly, he talks about the principles involved in a cure. We'll begin by first reading out the second aphorism from Organon. The highest ideal of a cure is rapid, gentle, and permanent restoration of the health, or removal and annihilation of the disease in its whole extent, in the shortest, most reliable, and most harmless way, on easily comprehensible principles. So, in this chapter, Dr. Kent divides this aphorism into three main components or three subheadings, and he discusses each of those components in detail, and in the process explaining most of the terminology that is presented in this aphorism. First, he says that if we were to ask a non-homeopathic physician as to what they mean by cure, okay, so they would reply in this way. For example, if it is a case of a skin eruption, then they would say that the disappearance of the eruption is equal to cure. If a patient comes to them with severe constipation, then they will say the opening up or the loosening of the bowel is cure. If a patient were to come to them with hemorrhoids, then they would say the removal of these hemorrhoids is cure. So as you can see, cure as per a non-homeopath is nothing but the mere disappearance of the present pathological state. He further gives the example of a knee affection. He says that if you ask them, what is cure, then they would say amputation of the limb to save the knee would be cure. And in acute diseases, they would say the patient's survival, the patient is alive, that itself is cure. Naturally, when patients see that their symptoms have disappeared, they would be amazed at the skill of the physician. They'll be really happy. But Dr. Kent says that this happiness will be short-lived because eventually the same patient is going to come back to the same doctor with another set of symptoms, a deeper manifestations, a graver disease, a more serious illness, a life-threatening pathology. He will say, "Doctor, you so wonderfully cured me of my skin disease. Why can you not cure me of my liver trouble?" Here Dr. Kent says that it was actually a failure to cure, because what was a harmless eruption on the skin or on the exterior of the person has been pushed inwards to his vital organs like heart, brain, kidney, lungs, etc. etc. So, something which was harmless on the exterior of the person has been pushed inwards to the more important and more vital organs of the human beings. And Dr. Kent says that this is nothing but suppression, and it will push the patient towards the path of death. So what are the three main components of second aphorism? So Kent has divided second aphorism under three subheadings. First is restoration of the health. Second is that cure must be prompt, mild, and permanent. And lastly, cure must be based on plain and intelligible principles. So we'll understand what he meant, or what his explanation of restoration of health is. So here, Dr. Kent says that Dr. Hahnemann has used the term restoration of health and not removal of symptoms. That is because when we use the term removal of symptoms, it just means that we are just talking about disappearance of the symptoms, mere disappearance of the symptoms. So when we use this terminology, we are actually referring to only the part of the person which is sick, and we do not consider the person as a whole being sick. Okay? So most of the time when we just remove the symptoms, we are just changing the aspect of symptoms. That is, the existing symptoms disappear and they are replaced by another set of symptoms. So he says that just the appearance of the disease image changes, but actually the essence of the disease has remained unchanged. And when we use this term removal of symptoms, we cannot call it a cure if this removal of symptoms is not followed by restoration of health. So what does Hahnemann mean by restoration of health? He means that whatever was disordered in the sick human being, if it is brought back to that state of order, re-establishment of that state of order in a sick human being, that is restoration of health. So when we say restoration of health, we are not talking about a particular part of the body. We are not talking about only the sick part of the body. We are looking at the body as a whole. We are looking at health as a whole. So this terminology has a holistic view. And whenever we say that the health is being restored, it means nothing but whenever there is an improvement in the external or outward symptoms of the disease, correspondingly, the patient will feel an inward improvement. That is, he will be able to realize by his feelings that he is getting better. Generally, he starts feeling better. Okay. So, now Kent says that the physician's sole duty is nothing but to restore the sick to health, as was discussed in the first aphorism in the previous chapter. Okay. And not merely the removal of symptoms. It is not the physician's duty to change the aspect or appearance of sickness. So this is about restoration of health. We will discuss about the second component of aphorism 2, that is the means to cure or the means of cure. So here Kent says that a perfect cure consists in restoring health promptly, mildly, and permanently. As told by Dr. Hahnemann in the second aphorism, that the cure should be rapid, gentle, and permanent. So when we say rapid, it means that as early as possible, as quickly as possible, or as speedily as possible. At the same time, the means of cure, that is what we use to cure the patient, should be very mild and gentle in its action. It should not increase the suffering of the patient. And when we say that cure should be permanent, it means that after a medicine has been given, the changes that it brings about should last, should be maintained. It's not like we have given medicine, the symptoms have disappeared for a few days, and then the person comes back again after a few days with the same set of symptoms. So we can call it a cure only and only when the effect of the medicine has given a permanent or lasting impact. Okay. At the time when Organon was being written, that was the time when there were the use of drugs which were very violent in their action. Okay, the prescriptions were not at all mild. There was measures like bloodletting, sweating, etc. Okay, with the belief that the patient is having excess of blood or whatever, and letting out the blood is cure. So of course, already the patient is having an illness, but at the same time, when more blood is being let out from their body, it leads to more effects. So what Dr. Kent is trying to highlight here is that those drugs, they used to give fast results, that is, they used to give speedy results, but their effects, their action and reaction used to cause more harm than the original disease itself. Now when it comes to the present day, in the present day, as in when Kent had written this chapter, And of course, part of it is applicable even to our times, right? uh, the drugs have changed just in their appearance. Okay, earlier probably it used to resemble in a different way. Now we have a lot of tablets, injections, capsules, etc. Okay, only the basic appearance of the drugs have changed. Their taste has been altered to please the patients. Like some of these medicines can be tasteless, or some can be sweetened, etc. Okay, but he says that the action of these drugs remain to be violent as ever. And he says that those older measures of bloodletting, sweating, etc., it's not that they have been discarded based on principles, because even in Kent's time, there were people, especially the older physicians, who wanted to go back to these measures of bloodletting, sweating, etc. Okay. He says that the present day medicines or present day drugs are even more powerful, and especially after the discovery of the chemical properties of petroleum, it has become an even more dangerous scenario, because the drugs of present day are having an effect on the mind. They are destroying the mind. Okay, they are having a very destructive action on the mind. There are drugs like cocaine, sulfonils, etc. Okay, most of their action and effects are still unknown. And then he goes on to talk about these petroleum based medications. Okay, these are slowly and insidiously violent. That is, their effects are not very noticeable. It doesn't happen overnight. It takes some time to see the dangerous effects of these drugs. Okay, the present day medications, as I already said, they are causing a destruction of the mind. They have an action on the will and understanding of the patient. He says that at least in the olden days, the drugs which were used were instantly dangerous and violent. As in, once you take those drugs, their actions become obvious to everybody, even a lay person, because those effects used to be on the surface. Whereas in the present day, these actions are on the mind, okay, slowly destroying the mind, and it is not so instantly noticeable. It takes some time for the patient to develop these serious drug effects. So these drugs, basically, even though they are giving quick reaction, these benefits are only apparent. They are never permanent. Because what happens with the use of these violent drugs is, if suppose the patient has presented to us with skin symptoms, the skin symptoms have instantly disappeared. But instead of the skin eruptions, there would be a new set of symptoms in the internal or in the interior of the human being. And this new disease is stronger and more tenacious. Tenacious means very stubborn disease. It doesn't leave easily, right? So a very tenacious internal disease has replaced this external manifestation, that is the skin eruption. So basically, just the appearance of the disease has changed, but its essence has remained the same. And this causes an internal destruction of the man, that is, the man is getting destroyed from within. So here he says, so that was about, rapid, the first component or first quality of cure, that is rapid results. So results should be rapid, but it should not cause any suffering to the patient. So in conventional system of medicine, definitely the results are rapid, but there are a lot of side effects, there are a lot of drug reactions. That is, the original disease is being replaced by this artificial drug disease, which is even more dangerous and powerful. Now coming to the second quality of cure, that is what Hahnemann must have meant by mildness. So here Kent says that a cure can be mild, or it can be called mild, only if it is flowing along the natural direction. Just imagine yourself sailing in a river or probably a sea. As long as you're flowing along the direction of the flow of the river or the stream or the sea, your journey or your sail is going to be very smooth. But the moment you try to sail against the direction of the stream, right, then it's going to be even more tougher to move, right? You are going to slow down. There's going to be a lot of turbulence. There's going to be a lot of, what should I say, of friction. Okay? So, same way, Dr. Kent here emphasizes that as long as we have given a medicine whose action flows along the direction of natural cure, only then the cure will be mild. Okay? And in that case, it will be so mild that it will hardly produce a ripple in the stream. The stream, as in the example that I had given previously of sailing in a river or a sea. Whereas in conventional medicine, the direction of cure, the so-called cure, is entirely in the opposite direction. So here Kent equates it to, pulling a cat by its tail upward on a hill, right? So cat is obviously going to put in some resistance. It's going to throw some obstacles, and we will not be able to drag it all the way up the hill without a fight. So same way, action of old school medicine or action of conventional medicine is in that direction. It is opposite to the direction of cure. In homeopathy, the curative medicine, or in general, the curative medicine will establish its action in a mild manner. Means it will be so gentle that the patient would hardly feel any more suffering. But while the action of the medicine is mild, the reaction may not be so mild, especially when there is a reversal of symptoms, reversal of the suppression, which is usually the work of conventional medicines. For example, a patient has come to us probably with some internal affection, and when we have given them the right homeopathic medicine, the internal symptoms are relieved, but the skin eruption comes back. So, this is the turmoil that Dr. Kent is talking about here. The skin eruption was originally there. It has been pushed inwards by the work of some conventional medicine. So, naturally, when the cure is happening, the suppressed symptom is going to come back, and that will cause some disturbance or some suffering to the patient, which is what has been called as turmoil. Okay, so 100% whenever there have been suppression by conventional medicines, when we give a homeopathic medicine, there is going to be a turmoil, there is going to be some suffering, no matter how mild the action of the medicine is, how gentle the action of the medicine is. So that's about the second component, that is qualities of cure. Like I said, cure should be fast, but at the same time, it should be gentle, that is, it should not cause any suffering to the patient, and it should be maintained forever. Once the medicine has acted, its effect should last. It should not keep coming back again and again. That is, it should be a permanent effect. Now we'll move on to the third component that was discussed or highlighted by Dr. Kent. That is about the principles of cure. Of course, in the first chapter, that is the sick, Kent has clearly established that cure has to be based on principles, fixed principles, unchanged principles. A recap, it should be a principle which is just like the law of gravitation, which is fixed, unchanged. No matter how many times you try to test it, it remains to be true. Cure should never be based on guesswork or empiricism or experiments. Okay? Now here he talks a little about, as a homeopath, what should be the aim of our study. So that again is principles. If you are trying to become a homeopath, you should be acquainted with the various principles and doctrines of homeopathy. You should be acquainted with medicines whose properties have remained unchanged since the beginning. You should be acquainted with the action of these medicines. So, how do these medicines act, or what are their effects on healthy human beings? And What are their effects on sick human beings? We should be acquainted with all these things. And not only that, we should be able to apply intelligently in our practice, and only then we can grow. Only then we can get cures, you know, which is nothing but removal of disease, restoration to health in a mild, prompt, and permanent manner. So, how do we know that we have achieved a cure? This is a question that is asked by Dr. Kent here. He says that if you were to ask an allopathic or a conventional doctor as to how do you know that the disease has been cured, in the beginning of the chapter, like he said, their answer is going to be that the pathological state has disappeared or that the patient has survived the illness. Okay? So that's going to be their answer. Patient did not die or that their manifestations had disappeared. But here Dr. Kent says that a homeopathic physician knows his patient very well. He knows them better than the conventional doctors. A homeopath will answer that when a person is falling sick, it is first the disorder of the internal man, right? The will and the understanding. And then the tissues will eventually develop the changes. So, we know that there is a cure when first there is an order in the interior and then there is an order in the exterior. That is the direction of cure. First the internal man has to improve, and then lastly the external manifestations will go away. So here we know that is the direction of cure, right? Internal first and then external. So if we observe that after our medicines are given, if the symptoms are progressing in this direction, that is internal symptoms improving first and then lastly the external symptoms improving, then we know that we have cured the patient. So here Dr. Kent talks about the order or direction of cure, which is nothing but the Hering's law of cure, wherein he says that first the will or the voluntary of the person will improve, then the understanding of the person will improve, and lastly the outermost, that is the external manifestations on the hair, the skin, the nails, the extremities, those changes will come up. This is the direction of cure. Okay, that is from center to periphery, from above downwards, that is from head to toe, from within outwards, from more important organs to less important organs, and in reverse order of appearance of symptoms. So what do we mean by this? Whichever symptom has come last will be the symptom to go first, and whichever symptom has come first will be the last to go. So usually if we see a person who has never taken any sort of medicines, we'll see that primarily this disease will try to appear in the external, that is in the skin or any less important organ of the body. But after repeated medications, these external symptoms disappear and they start developing some internal complaints. So naturally, when we give them a homeopathic medicine, firstly the internal complaints should relieve, and then as the internal symptoms are getting relieved, they will have those external manifestations which had been suppressed long ago. That's what he means by this reverse order of appearance of symptoms. So here Dr. Kent says that we will know that the cure is for certain, that the symptoms will remain permanently away if we see that after our medicine the symptoms are progressing in these directions. Okay? So this is how a homeopath will know that his remedy was of curative action and it was not just mere removal of symptoms. So suppose after our homeopathic medicine, if the symptoms are not following the order of cure or the direction of cure, then it means that our medicine was not curative in its action. Whereas if the symptoms are following the order of cure or the direction of cure, we can say that our medicine was of curative action. Because if we leave a person untreated, okay, then the direction of disease progress is always going to be inward, towards inside, more and more internal organs getting affected. It's never going to be naturally the other way around. That is, towards the exterior or towards the skin or towards the outer surfaces. The disease would keep progressing in chronic diseases from surface to center. Whereas a curative remedy will start throwing the symptoms back to the surface from the periphery. So uh, this reversal of symptoms, that is, symptoms going back to the surface from the periphery, is the reversal. Okay, this brings up the turmoil that was described even earlier. Kent says that this turmoil is necessary, even though it causes some suffering. This is necessary because this is the only possible form of cure. There is no other way. They have to go through the suffering in order to be able to achieve a cure. The manifestations have to be thrown up on the surface from the interiors. So this is what he means by return of old complaints. When a patient comes to us with any illnesses of the vital organs, the brain, the heart, the lungs, after our medicine, the symptoms have to be thrown outwards on the skin, the hair, the extremities, the nails, right? He gives the example of rheumatic heart disease. Okay, so suppose a patient has come to us with RHD. As his rheumatic heart symptoms start improving, his knees start becoming more and more rheumatic. So the patient will say, "Doctor, when I came to you, my knees were perfectly all right. I was able to walk. But nowadays, my knees have swollen up and I'm finding it difficult to walk." Here he says that ignorant patients or ignorant people don't want their old outward complaints to return. We see that even in present day, right? They're okay with internal symptoms, but one tiny pimple appears on the face and they want it to go away as soon as possible. People don't want their outward complaints to return, probably because of vanity. It's obvious to everybody, right? And if any manifestation is there on the skin, all can see it and all are going to ask about it. That is their concern. He says that if the doctor is ignorant, if he doesn't know the consequences, he will make a prescription which will drive the disease back inwards. So, in an RHD case, when the heart symptoms are improving and if the knees are becoming rheumatic, he says that a doctor who doesn't know the consequences will try to give him some medicine for the knee pain. Okay? And as he gives the medicine for the knee pain, the knee becomes better, but the heart becomes sick or the heart symptoms worsen again. That is nothing but the disease being pushed back inwards. He says that conventional doctors do not know these consequences, and this is their regular and only plan of treatment, and they innocently kill the patient. Because, see, knees are swollen, there is difficulty in walking, but at least the patient is alive. Whereas if the heart gets involved, is the patient going to live long if the disease goes on progressing? So he says that in some cases, after giving our medicine, only a partial cure is, if only a partial cure is possible, okay, and the old symptoms which have returned will continue to persist. We cannot sometimes completely cure the patient, but as long as his internal affection has been cured and it's only the outward symptoms, it's fine. The patient is going to live, right? And he says that this is the only possible way. This is the only direction of cure. Even if the patient finds the external symptoms little difficult to bear with, this is the only direction of cure. If he improves completely, it's well and good, but otherwise he will have to bear the external symptoms. Some cases are incurable, and in those cases, no matter how gentle or how mild means of treatment, that is, how mild medicines have been given, the suffering or the turmoil that the patient will experience during their partial recovery will be a lot. Even if the patient feels that the medicines are not mild, they are mild. It's just that they have to endure this suffering. There's nothing else that can be done in incurable cases. Dr. Kent says in acute diseases, this turmoil or this distress with the return of or with the reversal of symptoms is lesser as compared to that in old incurable cases or deep seated chronic complaints. Here, I'd like to give you an example that we encounter in our day to day practice in acutes. Suppose a patient has come to us with bronchitis, that is cough. Now we give a medicine. His bronchitis is improving, that is, the cough is improving. But as the cough is improving, he probably starts experiencing a little bit of sore throat, pain in the throat, or he may start experiencing running nose, sneezing, etc. Patient will come back and complain to us that, I did not have this much of nasal discharge or this much of sneezing. Please do something. But if we are to give a medicine to, to cure or to stop the discharge, then it is going to go back again to the lungs. And again the patient is going to come up with cough. So we must explain to the patient that this is the way of cure. Like, the lungs are more important organs. As the lung symptoms improve, the body is going to throw up the symptoms on the upper respiratory tract. That will remain only for a short time. Eventually that is going to go. Okay, so this is the direction of cure, from inside to outside. In cases of suppression, there will definitely be a return of old complaints on the exterior of the person. So that's what, like in my previous example, I was trying to tell you. In these cases where there is a return of old complaints, it is our duty as a physician to explain to them as to why these old complaints have come back, why it is necessary, and why they should endure it. If the patient is intelligent enough, they're going to understand. Okay? They're going to understand, and they're going to be patient, or they're going to wait with some patience also. Here, Kent says that as a conscientious physician, or as a person who knows what is right and wrong, this is the right advice that we must give to the patient. That even though these symptoms, these old symptoms, are little difficult to bear with, they have to be patient with it. Whereas a person who thinks, or a physician who thinks only about money or only about his pockets, he's going to try to give them something, just to keep those, just to relieve those old symptoms a little bit. He will worry that if he doesn't prescribe something, the patient may go to some other doctor. Dr. Kent says that this is evil, and he urges all of us homeopaths to choose integrity or conscience over pockets. He says that this conscientiousness or this integrity is a part of the principles of homeopathy. It is a part of our foundation. Okay? We have to adhere to these principles very strictly. We have to be thorough with the knowledge of materia medica and our principles in general. We have to apply these principles and materia medica intelligently. Okay? And only then we'll be able to get a fulfilling practice, a practice which is very delightful, which gives us a lot of happiness. Because only by maintaining these principles, we will be able to give cures, and because of these cures, we'll be able to earn a lifelong friendship and respect of a set of people who are worth working for. Okay? And not only that, Dr. Kent says that if we are following the principles and the rules of practice very strictly, we are going to have a clear conscience, right? End of the day, we don't have any burden, or we don't have this feeling that we are doing something wrong. It happens, right? Sometimes in our practice, we do get advice from some people that, if you don't give a fast result, the patient is going to go, or if you don't give some external application for the skin, the patient will lose patience and go off to some other doctor. It does happen, especially as a beginner. You will see that you'll be many times tempted to somehow retain the patient in your practice and probably later on deliver a cure. But whenever we think of, if you really have a conscience, whenever we think of doing some of these temporary measures, somewhere in the back of our mind, it keeps pricking us, right? Like, we shouldn't have done this, or would we have done this if it was our family member, or things like that. So, of course, as a beginner, all these things are going to be very tempting. But if we stick to the principles, if we follow and practice homeopathy, as has been told by Dr. Henneman, and as has been practiced by so many of the famous homeopaths in our history, like Dr. Kent, Dr. Boninghausen, Dr. Herring, etc., we are going to get a very, very good and very rewarding practice. So, here, Kent again tells us that as a physician, we must be very orderly in our life. We should also be very disciplined in our life. And at the same time, it is our duty to also inculcate this discipline in our patients. Because he says that unless and until people live in a disciplined way or in an orderly way, they will not be cured of their diseases. So, here, again, once again, he tells that as a physician, we must know what is meant by order. We must be able to find out what is disordered in a man, and we must be able to give him a cure, that is, to restore him to a state of health by using means which are mild, which are orderly, and which are permanent and based on fixed principles. So, coming to a conclusion, in this chapter, we understood what is notion of a cure as per a non-homeopath. We understood the three main components of aphorism 2 of organon of medicine. We understood the key difference between restoration of health and removal of symptoms. We understood that a perfect cure consists of these three qualities, that is, it should be rapid, it should be gentle, and it should be permanent. And lastly, we understood the various principles involved in a cure, the direction of cure, the principles that a physician should have, the duties of a physician. Right? So that's all for today. The references are as follows. All the images have been taken by Google only for educational purpose. Credits due to the original source.